None of the things that we do are a panacea, and everything builds on the effects of the other item. The body is so complex that nothing we can do is in a vacuum and requires the full toolbox, essentially, for some of our patients. Some of them respond beautifully to one thing, and some of them require the entire toolbox. You could treat some people's hormone symptoms with hormone therapy only, and then you'll have a patient who doesn't respond to a lot of things, and you find out at the end it wasn't hormones at all. They have something like Lyme in their house, and we have to treat their immune system to get them back to being able to function properly. So as far as my part of this, specifically talking about using peptides and how that plays into the entire patient case, how we can practically on Monday morning do the things that patient might need to push their DNA to start to be a more youthful expression of their proteins so that the patient is doing the things they need to do to be well.